Okay, so I just got here. One thing I've been doing every morning on this rotation, and this is my last week, is I've been picking a podcast to listen to, like a medical podcast. I typically go to Divine Interventions for like super thorough information, but this time I just listened to a Curbsiders episode on anemia because we've had a lot of patients that we've been treating that have developed like acute blood loss anemia, or maybe have an underlying history of anemia, whether it be of chronic disease or iron deficiency, whatever it may be. So I figured, today would be a really good day to just like recap on that. So I just watched just listened to the Curbsiders episode on anemia, and it was great. Highly recommend if you need a really good review of anemia and maybe some like things to catch that you didn't know. So yeah, I just got here. I'm running a little late because I'm sitting in here and I wanted to finish the podcast. So it's about 5 after 6, and I'm going to go down to the station that we type our notes at, look up anything that happened with my patients overnight, and then see if we got any new patients, go round on them, and then wait for the doctor to come, and then we round on them all together. So yeah. Going to see my next patient, walking up these creepy stairs. Yeah, then I'll go back and type up my notes and then get ready to present when the doctor comes around with us. Okay, so I just saw my other patient, so now I'm gonna go type my notes and just see if any blood work came back to check on anything like that. And then we do rounds at around like 8:30, and then we go get breakfast together, and then notes, and then more rounding.
No, don't get my face today because I didn't wear any makeup.
So today was a really bad day to film because we're actually getting out early and we didn't have much to do today. Mondays are like really busy, and then it can vary throughout the week. So after my last video, after I rounded on the patients, I went and I typed up my notes, and then we rounded with the doctor for like, I don't know, 30 minutes to an hour. And then we went down, we had breakfast in the doctor's lounge, and then we went upstairs, finished our notes, and then we went to the nursing home that's like attached to the hospital. We went over there, and I don't really know if it's a nursing home or like a short-term rehab center. I'm not sure like the exact definition. Anyway, so we went over there, saw a patient, and then came back over. Then we finished our notes and stuff. So we just kind of sat around waiting for like lab tests to come back today on the patients that we saw. But yeah, so kind of a boring day. So I'm leaving now, but maybe I'll film tomorrow in case we do something. Just got home, and look who is down here trying to step up his grill game. What are you making today?
Some burgers, low fat burgers.
Are you timing them this time?
No.
It's our little apartment complex area where the grill is. We don't utilize it enough. It's cute. Nothing to add for the people? All right, good morning, guys. Let's try this again. So this is round 2 of trying to get you some good footage in internal medicine. So I am leaving now on my way to the hospital. Also, if I get a chance, I will talk about some of the cases that I've had or that I saw yesterday. Just when I get a chance. I forgot to do that yesterday.
Sort of refresh us as to where to start. So before we even get going, I feel like this is oftentimes how sarcoid presents itself to us.
The hunt continues undrafted.
Okay, so we just finished our rounding. We just had some breakfast. So they are going over to the nursing home that's attached or like next to the hospital. And I asked if I could study because my shelf exam is in 2 days. And so the doctor we're with, he's so nice. He's like, of course, go study. So I am on my way to go back upstairs and study in the unit and see if we get any patients. So I'll keep you updated. I'm also going to give an example of like a presentation that we do on rounds, because I actually kept one that I wrote, and I'll just not say the patient name or anything like that, just so you guys kind of have an idea of like how rounding works and like how we give a quick presentation about our patient every day. So I came to a little break room so I could give you an example of how I would present a patient on rounds. So I'd start with the age and the gender, and then whether it's like post-op or was admitted. So for example, this patient was admitted and it was not like a post-op procedure. So sometimes on internal medicine, you'll follow up on orthopedic patients because you'll need to manage their medicine while they're inpatient after surgery. So not everyone gets a surgery and goes home. Some people get a surgery and then stay and get PT in the hospital and are monitored. So usually we get consulted on that to like manage their medications and everything else that's not ortho. So anyways, this would be an admit. So you would say, patient is this years old, is this gender, and was admitted on whatever day for recurrence of UTI, multi-drug resistant UTI, for which she was being treated with meropenem per ID, has been switched to Inmans, and has a history of, and then you read their history. So this patient had a complicated history, so diabetes, hypertension, hyperlipidemia, cancer, cirrhosis, and so you list those all off. So that's kind of your one-liner at the very beginning. So patient, age, gender, what they're here for, whether it's post-op or admission, what they're being treated for, or like what they originally came in with, and then their like a brief past medical history, like their problems, and that's your one-liner. You always start with that so they kind of have like the best well-rounded picture of what we're seeing this patient for, because you see a lot of patients on rounds, and so from day to day you might just forget little things. So you always restart with that one-liner. And then you go into what happened overnight. If they're like the first day you're seeing them, and then you give the full H&P, past medical, family history, allergies, review of systems, etc. But if this is someone that you've seen like yesterday, and then this is the next day you're seeing them, you go into what happened yesterday or what happened since you last saw them. So last night, or even during the day after you rounded on them in the morning. So for example, you would say something like this. So diabetes management saw the patient yesterday. They advised to stop metformin due to liver cirrhosis and to continue Trulicity. And they noted the A1C is whatever. You would say GI is also following this patient and saw them again yesterday. They suggest outpatient endoscopy, to start protonics, to give a transfusion as needed, monitor H&H closely, which is hemoglobin and hematocrit. They requested an AFP, which came back in normal limits. Nutrition also saw them, and then you go into that. Infectious disease also was following the patient. They suggested this, and like you read their notes and then you give the brief presentation to your attending. And then you go into how the patient's feeling. So you say patient is feeling better today, but reports blank and blank symptoms still that are persisting but seem to have improved. Denies nausea, vomiting, shortness of breath, chest pain, palpitations, diarrhea, constipation. Those are your general review of system things that you're going to go through right in the beginning. And then I go into, everyone does this differently, but this is kind of how I learned on this rotation for internal medicine. You go into vitals, and if they're stable, mention that they're stable. If they're not, mention anything that's abnormal. So typically I'll say they're stable and their last blood pressure was. Or you say they've been trending upward, or they're hypertensive, elevated blood pressure readings, and the last BP was. So that's kind of how you do the vitals. And then obviously if they're tachycardic, mention that. Then I go into labs, anything that we ordered yesterday or that's like pertinent for this morning. Typically everyone gets labs drawn in the morning, so when you go into round at like 7 in the morning, you typically have their labs. So for this one I said, AFP was normal per GI rec, PT-INR is normal, red blood cells are still low, and then so things that are pertinent I mentioned. And then this patient, like if they had thrombocytopenia and it resolved, you say thrombocytopenia seems to be resolved. I always give the hemoglobin and hematocrit. That just seems to be really important, especially post-op. People can develop acute blood loss anemia, and then other people just have anemia, so H&H is always important. And then you always mention glucose, especially if they're diabetic. So you would say the last glucose reading was whatever it was. And then if they have like hepatorenal syndrome or if they have cardiorenal, you always mention like GFR and creatinine, and if they're abnormal. But even sometimes I say when they're normal if it's indicated. And then I go into my physical exam, since I already touched on review of systems kind of in my progress portion, like the beginning of the progress note. I normally say like non-contributory except, and then I just name the pertinent positives or negatives. So for example, I would say no icterus, no palmar erythema, no spider angioma, good strength and pulses bilaterally, distant heart sounds like if they have a history of COPD or something like that, but regular rate and rhythm if you didn't hear anything. So yeah, typically I'll say non-contributory except, and then I'll name the pertinent positives and pertinent negatives to that patient's case. Then I go into my plan if I get to it. Sometimes when you're presenting to an attending, they kind of give the plan to you. Sometimes they want to hear your suggestions, and you would just say, you know, I talked to the nurse and they talked to infectious disease who recommends this, and you kind of just get all this information from reviewing the whole patient chart. So you look at other notes, you look at the consults, you look at the lab orders, you look at any of the labs that came back, and then you give this whole progress note every single day. So for example, a patient I had been here for 10 days, every day I'm giving a new progress note, but I'm giving the same beginning statement with that one liner of what they initially presented with, what their past medical history is, like the pertinent ones, and then what happened overnight, and then I give, you know, how they're feeling today, and then I give vitals, labs, and then physical exam stuff. So you'll do that every day. And then when they're discharged, it's easy to write their discharge note because you've been doing progress notes every single day on those patients. And on this rotation, we actually write everything ourselves, and the doctor just like reviews it and signs it. So like this rotation is very autonomous, and you know, you definitely take on a lot more work and you have a lot more responsibility, but it's a good learning tool. And I just figured, you know, everyone kind of, I feel like I always look up how do you present a progress note, or how do you know what type of physical exam to do. Let me know if that was helpful. I'm going to study now and then see if we have anything later this afternoon. Okay, so what can sometimes happen is we end up getting orthos patients in the afternoon that we didn't know we were going to get. And so what we do is we just kind of like wait around for our attending to come back, and then we do another set of rounds. And those are usually like people who are right out of post-op that had a surgery that ended, you know, maybe at like 1 in the afternoon instead of in the morning. So we do like a second round on them, usually around like 2 or 3 o'clock. Oh, I'm out of breath. I swear COVID ruined my lungs going up steps forever. But anyways, so yeah, we just round it again, and then you finish those notes on your ortho patients, and then we get to go. Some days that's at 5, some days that's at 2 o'clock in the afternoon. It really just depends like how heavy the admitting schedule is. But aside from that, I just wanted to say thank you guys so much for watching. I hope this was helpful. I hope that I can help you guys when you have to do progress notes, or you know, your rounds on internal medicine or whatever it may be in the hospital or even in a clinic. I hope that this was helpful for you guys. And my next rotation is my elective OB rotation in Georgia, so I may or may not film that. And then I have about 8 weeks from today until I take my step 2, so time is just flying. Yeah, but I will see you guys on the next one. Thank you guys for watching.